Welcome to another edition of Disability and You. I am Ganesh Singh and I'll be with you for approximately 30 minutes. On this edition, I will be having a discussion with Dr. Dheeraj Bansal, who is the Dean of the School of Medicine at the Texas American University, and we will be discussing mental health. Of recent, mental health has become a mainstream topic. This is as a result of the pandemic and also many prominent individuals, both in Guyana and globally, speaking up on the need for good mental health and also the issues that affect persons who might be in very stressful environments and so forth. Because of this prominence that mental health has been given, more persons are coming forward discussing the issues that they encounter in dealing with their mental health issues. Dr. Bansal will provide us with information on what is mental health and also how can we maintain good mental health. He will also share other pertinent information relating to this field. So Dr. Bansal, welcome to the program and thank you very much for facilitating this interview.
Thank you very much. Pleasure to be here.
Excellent. Let's get straight to mental health. What is mental health? We discuss it, but a lot of times we are not aware or we don't have a clear understanding of what is mental health.
So, I would like to describe mental health in as simple words as possible because when you start using the scientific definition, it sounds very complicated to people and it's very difficult to comprehend. So, if you will allow me, I'll explain mental health as a complete psychological, emotional, and social well being. So, these are the three components of mental health: emotions, psychology, and social interactions. Let me just explain very quickly about each of these components.
Go right ahead, yeah.
Emotions basically are the different feelings that we feel from time to time. To give you certain examples, feelings of sadness, anger, lonely, feeling worthless, feeling like nobody wants me, feeling like a failure. We all go through these emotions from time to time. We are all familiar with them.
Definitely.
Then going on to psychology, psychology basically is how we react to these feelings. So the scientific definition of psychology is the study of mind and behavior. And behavior is nothing but our reaction to these feelings. What do we do when we are feeling sad? What do we do when feeling angry? How do we react to that? So that's psychology. And social well-being means how you interact with your environment, and your environment consists of your family, your co-workers, and other people of the community. So when all these three components are in perfect balance, a person is said to be in good mental health. And if any of these components is out of balance, then we say the person might be suffering from mental illness. I would also like to add, as you were saying earlier, mental illness is so much more common than we think it is. And many more people are suffering from it. Unfortunately, when you say mental illness, the idea that comes to our mind is a person who is out on the road, shabbily dressed, but that is less than 2% of cases. Many people suffering from mental illness is as normal as you and me, sitting here and talking. Hence, there is a need to identify these mental illnesses early and do something about it.
Mhm. But you mentioned a lot of persons are affected by mental health issues.
Mhm.
How prevalent do you have empirical evidence to substantiate the conclusion that it is very common?
The studies done globally all over the world has shown that mental illness is much more common than we believe it to be. It follows what we call as an iceberg phenomenon. You know icebergs that are floating in the ocean.
Yes.
A very small tip of the iceberg is visible, and a very big chunk of it is under the level of the
I see.
ocean. These are called iceberg phenomenon, and many diseases like hypertension follow this trend. Mental illness is just like that. What is visible is a very small proportion, and what is not visible is a very big proportion. But there are studies available which shows that mental illness is very prevalent, and much more alarmingly, it is on the rising trend. As you rightly mentioned in the beginning, because of the pandemic, the pandemic has played its role too in making
Definitely.
mental illness much more severe. And the studies that have gone through globally, it's in the range of 20 to 30% of population being affected from mental illness, whether we are talking about Western countries, or we talk about any other part of the world. Guyana, we don't have any study, countrywide study, to give us the right prevalence of mental illness. And I'm happy to report here that IDRF, the uh, International
Development Relief Fund.
Development, thank you, and Relief Foundation out of Canada has collaborated with Texas American University to conduct a countrywide survey. And the purpose of the survey is simply to get a baseline data on how prevalent mental health is, or mental health conditions are in Guyana.
You mentioned, going back to what you said earlier, it's an iceberg phenomenon similar to hypertension and so forth, where just the tip is visible. Based on that, I would conclude that, and based on my research, that mental health is considered a disease. Why is it considered a disease? For many persons, we don't look at it that way because we associate disease with physical. But why is mental health considered a disease?
So, again, drawing the comparison from hypertension, blood pressure is a variable. And it's a known fact that blood pressure keeps going up and down. Just because blood pressure went up, a person doesn't become hypertensive. But when it goes above a certain level, we start calling it a disease defined as hypertension. Same things, these emotions that I was talking about earlier, and the reaction to these emotions, we all go through them from time to time. Sometimes we react a little bit more than usual. But then there is a level when it goes beyond that, when your reactions become too extreme, your emotions becomes too extreme, it goes into the category of mental illness.
But who are at risk? Or who is at risk for
Yes.
mental health issues?
So people, first of all, mental health illnesses has a genetic basis and an environment basis. We have to understand that. Genetic basis is the genes given to you by your parents. And when that is the contributing factor, there's nothing you can do about it. Just like diabetes traits are given by the parents, cancer traits are given by the parents. Similarly, mental health disease traits are also given by the parents. So that part is beyond our control. But the environmental part of mental illness, that's something we can do about. And to answer your question, people who are at risk would be somebody suffering from a chronic illness, uh, somebody who has gone through some kind of a trauma as a child, children of families that were separated, divorce, financial setbacks, people who experience financial setback, uh, people who experience some kind of a failure, students, for example, who failed exams, whose parents had very high expectations from them and they feel like a failure, uh, love failure, you're in a relationship and it didn't work. So these are some of the people, in my opinion, who will be at risk of mental illness.
And those persons that are at risk and the people who are affected by mental health, how is our mental well-being associated with our physical well-being or day-to-day functioning?
We have to understand that mental health and physical health are related. You cannot separate them. Whenever we have mental illness, it has physical manifestations. And whenever we have physical illness, it has mental manifestations. So they are linked. Unfortunately, the acceptance of physical illness is so much more than the acceptance of mental illness. And that is why we need to talk more about mental illness. It's not being talked about enough, in my opinion.
Yeah, because you still find persons, they cannot function physically, but they will pin that down to a physical problem and not a mental health issue.
Yes, and many mental health conditions has physical manifestation. People who are suffering from severe depression, for example, might have body ache, might have headache. These are physical manifestation of mental illnesses. And
But they will
the,
search physically for the cause.
they will treat the symptoms. They'll
Yeah.
keep on taking analgesics, but that's not going to cure it till the mental illness is cured. So you have to understand this concept of mind-body relationship, how your mind and body are interrelated.
Mhm.
And if a mental illness problem is causing physical manifestation, it will not go away till you treat the mental illness.
Mhm. But how do you treat mental health and when do you get treatment?
Again, just like many chronic diseases, hypertension and diabetes, even though there are medications available, but we call them as lifestyle diseases. Why we call them lifestyle disease is because if you make certain change in your lifestyle, you manage these conditions to a great extent.
Mhm.
Mental illness is a perfect example of the same thing. If you make certain changes in your lifestyle, it will help
Such
treating the
as?
condition, such as sleeping 7 to 8 hours every day, engaging in some kind of physical activity, which could be as simple as going for a morning walk, or playing a sports or go for a run, uh, some kind of physical activity which is proven to improve mental health. Having some kind of a relaxation habit, such as listening to music, doing yoga, uh, dance therapy. These are all things that will help you in relaxing and have a better mental health. Also, having a support group around you consisting of your friends and family whom you can talk to, you can laugh with, you can relax with, have a good time, as they say. So these are lifestyle changes that you can make to get a better mental health.
Mhm. And the more severe cases, what steps do we take in those cases, in those instances?
Again, the sooner you diagnose and start managing it, the less risk of going into severe forms in
Mhm.
majority of cases.
But if it
But
gets to that point.
if it gets to the point that there are excellent medications available, you should seek help early, go to the mental health care provider. A couple of decades ago, there were very few uh, medications available for mental conditions, and they had severe side effects too. Some people just have the same belief currently also. So I would like to inform them that there are a variety of medications available now to treat these conditions, and they are very safe, minimal side effect, and your life could be as normal as possible taking these medications. There are very good medications for depression. There are anti-anxiety medications available. So there's a wide range of them available
Mhm.
to treat these conditions.
Mhm. And also seeing a specialist like a psychologist, psychiatrist, is the key for severe cases.
Definitely, seeing a psychologist and then, if needed, a psychiatrist is the key. But again, as a community and as the government, it's our responsibility to make those services not only available but also accessible.
Dr. Bansal, why mental health is not part of the mainstream discourse? Why we don't discuss mental health as much as we should?
In my opinion, it is this stigma or this taboo that we have against mental illnesses. So, if somebody is suffering from it or a family member is suffering from it, we have this feeling of guilt or shame in talking about it because of this misconception that we have developed over last many years that it is something that is considered bad or should not be talked about, which is very unfortunate in my opinion. Because I think mental illness should be talked about as freely as physical illness because they are similar in many ways and also linked together.
Definitely. But is it because of how mental health was viewed, decades ago, where someone who had a mental health issue was, institutionalized and they were seen as an outcast? Do you think that is the basis for our current thinking towards persons with mental health issues?
Absolutely, because that time people didn't know what mental illness is. And when you say mental illness or mental disease, it was only meant for those extreme cases which were in an institution or in a mental hospital, and that's the conception unfortunately we carried over last many years. Now we know better that that extreme case that we are talking about is less than 5% of total mental illness cases. Majority of mental illnesses are people as normal as we see in our daily lives.
But you have, as I mentioned at the beginning of our discussion, more prominent persons coming out talking about mental health. We had the cricketer Ben Stokes taking a mental health break, and there are lots of other prominent individuals in our society discussing mental health. Even Ed Sheeran would have discussed being in a dark place. Why are people still scared? Normal individuals still scared to come out and say, you know what, I think I might be affected by my mental health issue. Let let me get help. Why are people still scared?
This is something we call as public perception, public opinion. And unfortunately, once an opinion is formed, it's difficult to get rid of it. Hence, it's very important that more and more prominent people talk about it. It should be discussed as much as possible. It should be part of the school curriculum. There should be community activities that talks about mental health. So the more frequently and on multiple forums when we start talking about mental health, that is when the public perception is going to change. That is when people will start feeling okay, it's fine to talk about mental health. It's nothing to be afraid of, nothing to be ashamed of. Just like I talk about my blood pressure, I talk about my diabetes, it's okay to talk about my depression and my anxiety disorders too. That's when the public perception will change.
How can we take some, or what concrete steps can we take to raise the level of awareness to get it as part of the, as I said earlier, the mainstream discourse?
Level of awareness, first of all, should be focused on few points, in my opinion, that mental illness is as common as physical illnesses. There are many people who are suffering from it, so you are not a rare person who is suffering from mental illness. 30 to 20%, 20 30% population is suffering from it. It's okay to talk about it. Don't be scared, don't be ashamed to talk about it. These are There are preventative measures that can be taken so that you can improve your mental well-being and mental health and hence reduce the risk of mental illnesses. That's a very strong message that should go out. uh, uh, these are few awareness points that I can think of.
Hmm.
In terms of, if you will allow me, if in
Go ahead.
terms of what we can do, I would say that we will have to make effort at each level: individual level, family level, community level, and government level. Individual level, as I was talking about lifestyle changes, getting enough sleep, engaging in some kind of physical activity, staying in a positive frame of mind, try some relaxation techniques, listening to music, join a dance class. That's individual level. Family level, talk to each other more often. One thing that I have heard people practicing is like no phone, no TV time. They say evening 2 hours No family member will use any phone or TV, and they'll just sit together. Having dinner together is another family activity. So these activities can be implemented at family level to improve mental well-being of the entire family. And then community level, there should be groups where people should be invited to talk freely about their mental health issues, mental illnesses. There should be advocacy groups at community level, which should be promoting mental health talks and mental health services, and of course mental health care providers at community level.
Mm-hmm.
And then coming to government level, government should be committed to have policies, to have national program around mental health and mental illnesses. uh, there should be finances available to finance these programs. The government should assure that there are enough mental health care providers, uh, and they're accessible too to different regions of the country. So a combined effort at all these levels, I think, will ultimately culminate into a better
Mm-hmm.
mental health overall.
And I'm gonna ask you a question, and I know that you have not done the research,
Hmm.
but I'll seek your expert opinion on this. Do you think because persons are living more isolated lives in a sense of living a life that they're engaged with their phones, their devices, they're mostly online and not being or participating in physical activities like they were in the past, playing together at the community centers and even in schools, children are not physically active as they were 30, 40 years ago. Do you think there is a correlation with the lack of physical activities and the increased use of devices and the high number of mental or the increase in mental health cases now?
Definitely. I might not have done research myself, but I have seen studies like that which have proven this point, what you're saying. Lack of physical activity, and isolating themselves. Isolation itself is a risk factor for mental illnesses, and not interacting, not having that shield of friends around you because you are so much engaged in this social platform online.
Mhm.
And definitely that definitely contributes to mental illness.
Great.
And also I would like to add the competitive nature of current times is also a contributing factor. Everybody is so stressed, and they are not practicing any activity to de-stress themselves. So when you're stressed all the time, it will have a higher risk of changing into some kind of mental illness.
And the government would have made, or Ministry of Education, or the government through the Ministry of Education, um, of recent started to increase the number of guidance counselors in schools, mostly in secondary schools. But do you think at the same time they should increase programs to promote physical activities?
Definitely. We keep coming back to this thing again and again, that physical and mental health are related. So better physical health automatically
Hmm.
means better mental health. I would also like to add that providing counsel is a very good step and should be highly appreciated. But what will make the children come to these mental counselors? Just placing them physically is not going to be enough. Mental health should be talked about more in the school curriculum. You have to make your students more aware that these are mental health, and mental illness does not mean that you have something very debilitating or something very extreme. It could be much before that. And if they seek counseling uh, much early on, their risk of going into severe form of mental illness will be much less.
Hmm. What role as members of society we have in fighting this major public health issue?
Biggest role we can play is talk about mental health and mental illnesses as much as we can, and as many platforms as we can. We have to make it normal talking about mental health and mental illness. That would be the biggest role, I think, in my opinion. And then First of all, we should practice ourselves the healthy lifestyle practices as I was talking about, and encourage our family members to lead a healthy lifestyle, and then talk about it in the community whenever you get a chance. We should rise up to this responsibility in our communities to be advocates for mental health.
Excellent. Dr. Bansal, is there anything else you would like to share before we conclude this interesting discussion?
I would like to say to conclude our discussion is that mental health is as okay to talk about as physical health. It's time that we remove this taboo and stigma of mental health that we have been carrying for too long. We
Mm,
should embrace it as any other normal discussion like our food, our drinking, or our physical health. Similarly, we should be able to talk about mental health as well. The sooner we do it, the sooner people with these conditions will come forward and feel okay and normal to come ahead and come forward and talk about it. And the sooner we'll deal with these issues, the better mental health is going to be as a country and as a community.
excellent. Dr. Bansal, I want to thank you very much for sharing with us. And I trust that the information you would have shared on this edition of Disability and You went a far way in raising the level of awareness within our society.
Thank you very much.
Thank you very much. I will be back with you next time for another edition of Disability and You.